Study Session 3, Visual Impairment. Introduction. In this study session, you will be introduced to another exceptionality which is commonly and quickly noticed in our society. Our society associates this exceptionality with begging. Until today, many people are still showing sympathy by offering them money or other gifts, even when they are not demanded. This study session will focus on definition, prevalence, causes, characteristics, educational program, and prevention of visual impairment. Learning outcomes. When you have studied this session, you should be able to 1. Point out visual impairment. 2. Outline the causes of visual impairment. 3. Highlight the characteristics of persons with visual impairments. 4. Present programs through which persons' visual impairment can be educated. And 5. Highlight measures that can prevent visual impairment in our society. The meaning of visual impairment. Vision is an important sense for interpreting the world around us. When vision is impaired, it can have a detrimental effect on the physical, neurological, cognitive, and emotional development on the person concerned. The phrase visual impairment is sometimes taken to connote the following visual impairment: vision losses and vision problem, both of which refer to the physical loss of part or all of useful vision. On the other hand, the phrase may combine those who are totally visually impaired, short-sighted, long-sighted, or astigmatic. People with total visual impairment are those who cannot read, write, or print after all optical corrective measures have been taken, but still use Braille as a medium of reading and writing. Conventionally, the professionals described such people as those who can see an object at only a distance of 20 feet or closer, when a person with normal vision can see the same object at a distance of 20 feet. Hence, they are said to have a visual acuity of 20 or 200 or less in the better eye, even with correction. People with low vision, which in time past were categorized as blind, have some vision which could be developed and used effectively, especially in the area of mobility. Some of these people are neither totally blind or partially sighted, but they have limitations in distance vision. They are able to see objects and materials in their immediate environment within a few centimeters or at most few meters away from their position. People who are partially sighted have a visual acuity of 20 or 70. Being partially sighted should not be taken to mean the midpoint between normal sight and blindness. People so classified do carry out most of their daily activities by using their remaining vision to the fullest. Many of them suffer from myopia, short-sightedness, hypermetropia, long-sightedness, and astigmatism, blurred vision. Myopia is a condition in which the eye continues to lengthen during the growth of a child to complete stature. Distant objects are out of focus. This is because instead of ray of light or object entering the eye to fall exactly upon the retina, the object or light forms an image in front of the retina, causing distant objects to appear blurred. The eye that has this kind of problem is unable to achieve focus of the image on the retina. A child suffering from myopia finds it difficult to read material from the chalkboard, from the back seat, stoops over reading material, gets tired easily while using the eye, etc. Myopia can be corrected with concave optical lenses in spectacles. Hyperopia or hypermetropia is simply an error of development of the eyeball in which distant objects are seen clearly but closer objects appear blurred. The error causes the eyeball to be oval in shape instead of being spherical. As a result of the oval shape of the eyeball, the light ray entering the eye focused behind the retina, causing a blurred vision. Hypermetropia can be corrected by spectacles with convex lens. Astigmatism is caused by an irregularity in the curvature of either the cornea or the lens. As a result, the light rays are refracted unevenly, such that those horizontal and vertical rays are focused at different points on the retina. The result is that the picture or impression that the eye sees is not sharp, clear, and exact. In most cases, astigmatism can be corrected. Presbyopia is a condition in which the lens of the eye loses its ability to accommodate near objects. Persons suffering from presbyopia usually have a blurred vision, difficult with reading, experience tired eyes, or aches while doing close work. Most people at the age of 40 and above develop some degree of presbyopia. Causes of visual impairment. For a better understanding, visual impairment also can be grouped as we did in the case of mental retardation under prenatal, perinatal, and postnatal periods. 1. Prenatal causes birth. If a pregnant mother is attacked by German missiles during the first 3 months of gestation, bleeding from the genital tract anytime from 28 weeks of pregnancy until the child is born, It is called antepartum hemorrhage. Hereditary factors like albinism, congenital contract, which is as a result of malnutrition during the period of the early life of the fetus when the eye lenses are still growing rapidly. Congenital diseases of the cornea, lens, retina, or optic nerve. Heavy smoking during pregnancy. Venereal diseases. Drug abuse. 2. Prenatal causes. Delayed labor, which causes traumatic pain to both mother and the child. Wrong use of forceps during delivery. Malpositioning of the child. Retrolental fibromyalgias. Heavy application of oxygen on tenderizer, especially in premature babies. 3. Postnatal causes. Undue or severe pressure on the eyeball, glaucoma. Malnutrition, accident and injury, illness, cataract, onchocerciasis, river blindness, trachoma disease, old age, also known as senility, diabetes, keratitis, that is direct contact with discharges from the eye of an affected person. Signs, characteristics, and features of visual impairment. 1. Failing to complete long reading assignments or other school tasks involving extensive eye use, especially when time is limited. 2. Students remembering and understanding material read to them better than which they read themselves. 3. Confusing letters and words which look somewhat alike. 4. Covering or scratching one eye while reading. 5. Skipping letters, words, or lines while reading. 6. Having difficulties of copying from textbooks, workbooks, or blackboard or tempo board. 7. Getting tired quickly or being distracted while working at the desk. 8. Being confused by details such as those appearing on maps and diagrams. 9. Writing unusually small or large characters or very poorly. 10. Appearing clumsy and reluctant to participate in play. 11. Having poor eye-hand coordination. 12. Rubbing or brushing eyes frequently. 13. Thrusting the head forward or squinting when looking at near or far objects. 14. Complaining of dizziness and headaches. Educating the visually impaired. We want you to know that it is the right of every child to go to school. His or her disability notwithstanding, according to the United Nations Declaration and as contained in the National Policy on Education. So, the visually impaired child has the right to good education in Nigeria. It will be a great disaster to the child and nation if education is denied to a child, and more importantly, a child with special needs. In Nigeria today, every child is given access to free education under the Universal Basic Education UBE up to junior school level, that is JSS 3. The visually impaired child should be exposed to education early in life in order to overcome many emotional problems that are associated with the disability. After a child has been diagnosed as having visual problem, it is at best to place the child on an educational program that suits him. Such a child can be placed in a nursery school where meaningful materials are provided. Those materials provide a variety of experiences such as size, texture, weight, moisture, dryness, coolness or hotness, etc. There should be educational toys that can appeal to their senses of touch, hearing, smell and taste to compensate for their sense of sight that is missing. In Nigeria, children with visual impairment can get to any level of education without much difficulty. There are a number of educational programs that are available. Some of them are examined below. 1. Special school. In this case, the children with visual impairment are all together in the same school environment in training and learning together with experienced teacher. For example, Pastel School, Surulere School, Ogbomosho School for the Blind, Ogbomosho, and several others. 2. Integrated school. In this case, both the sighted and the visually impaired are together in the same compound, but may have separate blocks or classrooms for learning. This promotes social interaction and integration. Examples are the School for the Deaf and Pastel School, both sharing same environment but not completely mixed together. 3. Inclusive education. This is a new innovation that encourages all categories of special needs children and their normal counterparts to learn, interact, and socialize together in the same environment with individual child's needs taken into consideration. Basically, in providing education for the persons with visual impairment, the environment should be conducive for easy accessibility and learning. Teachers of the visually impaired, according to Eward and Owsley, 1980, must be able to 1. Instruct the visually impaired pupils directly within the classroom and individually too. 2. Obtain or prepare specialized materials. 3. Put reading assignments into Braille, large print, or tape recorded form. 4. Interpret information on the child's visual problems and visual functioning to other educators and parents. 5. Suggest classroom and program notification which may be advisable. 6. Help plan the child's educational goal and intimate and maintain contact with various agencies as well as keep records of services provided. And 7. Consult the child's parent and other teachers. Prevention of visual impairment. Visual impairment can be prevented in our society if not completely eradicated if the steps are followed. 1. The public should be educated on the various sources, causes, and effects of visual impairment. 2. People should report immediately to the various agencies responsible for eradicating some diseases if noticed in any environment without delay. 3. Trachoma disease, which is a major cause of eye problem, can be prevented by keeping the homes and environments clean, since the disease thrives best in a dirty and overcrowded environment. 4. Regular eye examination should be introduced in schools and the society on the whole. 5. Self-medication should be avoided and any ailment should be reported to and treated by specialists. 6. Spectacles or eyeglasses should not be used except if and when recommended by specialists. Study session summary. In this study session, you learned that visual impairment, being one of the common exceptionalities, is not a hidden case among people with special needs. The characteristics or features of children with these exceptionalities have been made clear. These exceptionalities have been clearly spelled out to assist teachers in helping the children with these exceptionalities. Different types of visual impairment have been examined, as well as the causes of visual impairment in general. We equally discovered that they can be educated provided all needed materials are made available in our schools and the society on the whole. And more importantly, ways of preventing visual problems were discussed in this study session. That ends study session 3. Thanks for listening.